The nation's top infectious disease expert is warning of a holiday surge as coronavirus cases skyrocket across the U.S. Dr. Anthony Fauci says we haven't yet seen the peak of Thanksgiving infections, but warns Christmas and New Year's could be, quote, even more of a challenge. The U.S. has now confirmed more than 14.8 million coronavirus cases. More than 283,000 people have died. In California, 33 million people are under stay-at-home orders. All non-essential businesses have been closed. And in New York, Governor Cuomo says indoor dining could be put on hold as early as next week. All of this comes as the UK prepares to roll out the Pfizer vaccine. The Food and Drug Administration could authorize it in the U.S. this week. Carter Evans begins our coverage in Santa Monica, California.
California hospitals are filling up fast with cases skyrocketing. Tonight, nearly everyone in the state is being ordered to stay home. At the height of holiday shopping, all stores are now limited to 20% capacity. Hotels are being told not to take in tourists, only essential workers, and at restaurants, no indoor or outdoor dining. Without that revenue, Angela Marston says she may have to close her restaurant. In the same parking lot, a production company legally set up catering for its crew.
Tell me that this is dangerous, but right next to me as a slap in my face, this is safe.
Tonight, a grim reality. Every hour, the U.S. is seeing more than 8,000 new COVID cases and nearly 100 deaths. Dr. Anthony Fauci telling Nora O'Donnell today, the worst is yet to come.
The blip from Thanksgiving isn't even here yet. So we're getting those staggering numbers of new cases and hospitalizations before we even feel the full brunt of the Thanksgiving holiday.
To illustrate how fast the virus can spread, this map shows cell phone signals of Penn State University students as they traveled Thanksgiving weekend. In Hawaii, a somber gathering at Pearl Harbor to remember the day that will live in infamy when 2,400 died in the attack that launched America into World War II. Nearly the same number of COVID deaths are now reported every day nationwide. In the UK, the vaccine rollout begins tomorrow in more than 50 hospitals in what's being called the biggest health challenge the country has ever faced. Here in the U.S., the FDA could authorize the Pfizer vaccine by the end of the week. Once there's approval, the first shipments could come within 24 hours. Last week, Chicago mourned the death of Lupe Lopez, a longtime 911 dispatcher. Lopez's wife was hospitalized at the time, and family members were hopeful she'd return home soon. Maria Lopez died on Saturday, also from COVID. Maria's daughter told the Chicago Tribune she screamed into her pillow so no one would hear her pain.
Tomorrow, California restaurant owners will be in an L.A. courtroom. They're fighting the ban on outdoor dining. They say there's no data showing that outdoor dining is a source of COVID spread. The judge is now telling the county to prove it. Elaine?
Carter Evans, thank you. The number of Americans hospitalized with coronavirus has nearly doubled in the last month. And in Nevada, the state has the highest number of COVID hospitalizations per capita. David Begnaud shows us how one hospital there was forced to take drastic measures.
Renown Health in Reno, Nevada services 1 million people, over 100,000 square miles. And now the hospital is in crisis mode.
Look at what they have had to resort to. They're putting patients in their parking garage.
Our frontline caregivers are seeing things that they never would have imagined.
Anthony Slonim is president and CEO of Renown Health. For him, COVID is personal.
This condition took my father's life. We couldn't be there for him, but I know as a former ICU doctor that they were there comforting him.
On the day that Slonim's father died, the field hospital opened. 265 people have been treated here in just the last 3 weeks.
Nobody who's gone into medicine ever thought they would be providing care in a parking garage.
Jacob Keeperman is an ICU doctor at Renown Health. Keeperman had just moved to Reno to start working here and managing the field hospital when he tweeted this picture right before it opened. Some people tweeted that it was fake, and one of those tweets was retweeted by President Trump.
Would any hospital want to show that they are operating out of a parking garage if it wasn't real? People's loved ones are dying every day.
Since March, more than 2,000 people have died in the state of Nevada from COVID-19.
I have not seen anything like this for the time that I've been in healthcare.
Janet Baum is the field hospital's nursing manager.
Never in my wildest nightmares would I ever have thought that we would ever see something that would be killing this many people.
That's where we started our morning, in Reno, then made the nearly 7-hour drive here to Las Vegas. And as soon as I arrived, I spoke with one of the lead ICU doctors here at the major hospital in Vegas. And she said they are so incredibly busy in the ICU with some of the sickest COVID patients. You know, before I toss back to you, Elaine, I want you to know that in Reno, they have a lot of other things to do that are more important than worrying about a television crew inside. But they wanted us to be there. They wanted you to see what they're doing, because ever since that tweet went out suggesting that what they were doing was fake and the president retweeted it, they didn't invite us in because we called, but they said, absolutely, come and show people just how real this is.
All right, David Begnaud, thank you. For more, let's bring in Dr. Teresa Amato. She is the chair of emergency medicine at Long Island Jewish Forest Hills. Doctor, thank you so much for being with us. So the FDA could approve Pfizer's emergency use application this week. The head of the Trump administration's vaccine push was asked about the timeline for distribution on Face the Nation Sunday, and I want to play some of what he had to say. Let's listen.
I think we may start to see some impact on the most susceptible people probably in the month of January and February, but on a population basis for our lives to start getting back to normal, we're talking about April or May, and therefore it's absolutely vital that everybody, take comfort in the fact that we have light at the end of the tunnel and find the energy in that to continue to wear our masks, distance, wash our hands, pay attention to what we're doing to make sure that we are there by the spring to benefit from the vaccine.
So, Doctor, in your opinion, is this a realistic timeline? How long do you believe it'll take until the vaccine makes a dent in the severity of the outbreak here in the U.S.?
So I have to say I completely echo and agree with what was just stated. So the FDA hopefully will be approving it this coming week, and then they'll be ready to be sent out to all the different sites. I think it is going to be a little bit of a lengthy timeline. I think it will be several months. Remember, it's not just one shot, it's 2 shots, several weeks apart. And there's a lot of logistics between the freezing and the thawing and timing that as well. But we are very hopeful that by January, we'll be able to start really vaccinating quite a few people here in New York.
Well, what will you be watching for, Doctor, when the first doses go out? And what would you say to those who may be concerned about the safety of the vaccine, given how quickly it was developed?
So I can understand people's concerns. What I've learned during COVID are all feelings are valid. So I would say if people are anxious and nervous, I can accept that that's how they feel. But we really have to look at the science. This particular vaccine has now been studied in literally tens of thousands of volunteers. And even though it was called warp speed, which maybe sort of implied that it was going too fast, I would say that's not really true. They were being very mindful, and they did make this vaccine very safely. They've tested it on, again, tens of thousands of people, and it's been deemed so far to be safe. And so once the FDA says that it's good to go, I would encourage people to speak to their healthcare provider, their doctor, to find out where they are online to get it.
Well, as we just saw in that piece before you, hospitals are running out of space, and we saw that one facility resort to using a parking garage. Dr. Amato, you are a chair of emergency medicine. Give us a sense of what is going on in hospitals on the front lines right now.
So I see these scenes, and it's really brings me right back to where we were in March and April. Unfortunately, Queens was the epicenter back in the spring. And so my heart goes out to those emergency departments and ICUs, because I remember what it felt like when it was at its height here, again, back in the spring. I think when you're in it, you're just getting through it day to day. You're just thinking about the patients. You're thinking about the families. I think one of the hardest things about COVID for us was the lack of visitation. We couldn't have visitors in for safety reasons. And so where you normally can talk to families quite easily and discuss what's going on with their loved one, That was really heartbreaking to have people so sick and not be able to have their family members here. So I really remember that. Again, I think when you go into emergency medicine, you're not hoping for anything like this, but you're preparing for it. It's something you learn in your training. We call it mass casualties, and this really is a mass casualty event, and that's how you treat it. So I give them a lot of credit for being inventive and finding new places to take care of their patients, like parking lots.
It is sobering, Doctor, to hear you say that this really is a mass casualty event, given your level of experience and having actually gone through the surge in the spring in New York. Well, Dr. Fauci also warned that Christmas and New Year's could trigger more cases in the U.S. than Thanksgiving. Why is that, Doctor, and what lessons can we take from Thanksgiving to decrease our risk and avoid another surge in infections?
So I think as we're getting into the colder months, it's getting increasingly harder to find ways to do things more outdoors. So Thanksgiving, we had a lovely weather here in the Northeast, and many people were able to be outside as much as possible. I know personally that's what we did. We put a heater outside and tried to stay outside as much as possible and try to really keep it to a very, very small number of people in the house. But as we go into the winter months like December and January, it gets increasingly difficult to do anything outdoors. So the concern is there are going to be more people indoors with close contact. We're also heading into what is normally our flu season. So the concern is that, if we get another surge because of the holidays and it's right on top of the flu season, are we going to see people that are getting both of those viruses at the same time? I think we're still going to have to say, this is a marathon, not a sprint, and we are getting really close to that finish line. So now is the time to really find that last bit of energy you can. If we can get through this Christmas and this New Year's and you really still self-isolate, think about next Christmas and next New Year's and how wonderful that will be. So really just try to wear the mask, try to stay outside if you can, 6 feet apart. And just remember, there's light at the end of the tunnel, and we're going to get there. We just have to be really, really vigilant.
It's a really important message and wonderful to think about next year, this time, where we might be if everyone is able to do their part and take some personal responsibility here. Dr. Teresa Amato, thank you so much, Doctor, for your time. Really appreciate you talking to us.
Thank you so much. Stay safe.